Today we have Dr. Deanna Mosley-Lawrence for our Q&A with the veterinarian. Dr. Lawrence attended NC State University and pursued her bachelor's in animal science, followed by her doctorate in veterinary medicine. In 2009, she opened Hope Animal Hospital, and soon after she created Hope's Chest, Inc. And do you want to say a little about what they do?
We are a nonprofit that we kind of have a special niche in the world of nonprofits in that we actually are a medical fund for hurt and injured animals that come into our local animal control. And so what we do is we provide medical care for animals that don't have anybody to actually provide that care for them.
Today's video is on rabies. So what is rabies?
So rabies is actually a virus that is actually a rhabdovirus. And it's a virus that not many people realize it only affects mammals. So it does not, birds can't get it, or reptiles or amphibians. It's a mammalian virus.
And then how is rabies transmitted, and are there any ways to prevent getting rabies?
So the virus itself is transmitted and found in the animal's saliva. And so usually what happens is there will be a bite. And so either a wildlife animal or a dog or whatever will bite another animal, and so it's transmitted that way. Wildlife is actually the primary group of animals that carry rabies, and so that's where it's a public health concern, because when we as humans come in contact with wildlife, or our domesticated animals come in contact with wildlife, that's where it increases the risk of exposure, and of course there being a potential infection occurring. Prevention is actually quite simple. And all you have to do is just vaccinate your pets. You know, humans don't routinely get vaccinated. I'm actually vaccinated for rabies because it's required, since I do handle so many animals. But the most important thing, rabies almost became completely eradicated just by vaccinating animals. And I think it was in the 1960s when the vaccine was actually created. But rabies was so prominent, and then just with the vaccination of domestic animals, dogs, cats, it almost eliminated the disease. And so it wasn't for a while very prominent, but it's starting to creep more and more and more and more now, because I think a lot of the reason why is because we are expanding into areas and we're moving wildlife. And so wildlife is becoming more concentrated, and so then there's more transmission between wildlife, and then our animals are also getting, they're running out in the woods or whatever, or raccoons are coming closer to homes because they're searching for food. And so there's more contact that way between our pets and wildlife. So, but again, prevention, vaccinate, most important thing.
So if my pet does get rabies, what are the symptoms of it? How do I recognize it?
So the rabies itself actually is seen in 3 different stages. So the breakdown is you have what's called the prodromal state. And so that's actually the first 2 to 3 days of the virus actually being in the brain. So let me go backwards and actually talk about how the virus starts. So if let's say a dog gets bit by a raccoon that's rabid, what happens is that the bite itself, saliva actually penetrates into the muscle. And so then from that point, because the virus is actually in the saliva, it'll work through the tissue and travel through the nerves. So what it does is it'll go through the muscle into the nerves, and from the nerves it'll make its way to the brain. The crazy thing about this, it actually can take up to a year after a bite for the actual rabies virus to actually make it to the brain. Now most of the time it's usually within 3 to 8 weeks, but it can take as long as a year. But once it's in the nervous system, then it'll travel to the brain. When it gets into the brain, that's when changes happen. So that first state that I mentioned, the prodromal state, that'll be the first 2 to 3 days that the virus actually gets into the brain. Then you might notice some behavior changes in your pet, because it affects the nerves and how the larynx works. They actually have a change in their voice. So the meow might change, or the bark may change, because there's starting to be paralysis of the larynx. Or you may actually see them, and I'm not really sure why this happens, but they'll actually start being reactive to the area where the bite originally occurred. I don't know if the nervous system is overstimulated, but you will see them starting to lick or scratch the site of the original bite. Then you get the next stage, which is the excited stage, and that'll be over the next day to 7 days. And that's what most people know of as like the mad dog stage. And with that stage, they may actually act like they have no fear. They'll start hallucinating. They'll be extremely aggressive and actually attack. Now, that's what most people notice or remember about, like, you know, the movies that showed dogs with rabies, and To Kill a Mockingbird, or Old Yeller. Any of those are the things you see, that mad dog stage, but they can actually skip that stage. It can actually pass completely into the paralysis stage, and that's a lot of people know this as the dumb stage. So that can actually happen in a few days, and the animal will start acting weak, become paralyzed. They can't swallow. They start salivating, so that's the one sign a lot of people do know that the animal will do, but that phase leads to death. There's no stopping it. So from that first stage to the dumb stage, you're looking at 10 to 14 days.
So it's
And there's death.
pretty soon.
Yeah, once that virus attacks the brain, within 10 to 14 days, that animal will be dead. There's no stopping it. Death will occur. So, and that's why a lot of times there are quarantines for 10 days or for 14 days. Because if your dog or cat has rabies, they'll show it that quickly. So, I mean, you'll know pretty quick, unfortunately, that they have it. But there's no treatment. Once the animal has it, there's nothing you can do.
Yeah. So since rabies is also can also be harmful to humans, what do I need to do if I get exposed to it, if I get bit, or something like that?
So the first thing is report it. Just from the point of, I think a lot of people get scared to tell somebody that something happens, but if an animal bites you, the first thing you should do is wash. Immediately, any type of bite, no matter what, just cleaning it, you'll decrease the chances of a bacterial infection or whatever. But if by chance it's a wildlife animal or an animal that is just suspicious of as being aggressive, once it bites you, your life is at risk. And that's why it's so important to actually call. And so the thing you do is you call animal control. And you can call them in the middle of the night. I mean, they're available 24/7 for us, but from a public health standpoint, when you're bitten, if that animal has any possibility of being a rabid animal, you could die. And so that's why it's so important to make sure you do everything necessary. By reporting it, what will then happen is the animal will be picked up, whether it be wildlife or your dog or a cat, and then it'll have to be determined, okay, are they current on a rabies vaccine? If they're current on a rabies vaccine, then you should be fine. But if they're not current, then the animal's going to have to be tested. If it's a wildlife animal, it'll immediately be tested. And so the whole reason for that is because of the human side of things. Because death can happen, you have to make sure that you're protected. So, and I don't know if you knew this, but the only way to test is to actually test the brain.
Oh, really?
Yes. There is no other way to test them. There's not a blood test or anything. So unfortunately, as a result, if the animal is not current on a rabies vaccine, then that means they have to be either euthanized immediately, and the head has to be sent off to the state lab to be tested. The only way that you could possibly get out of that, as the only possibility, is if you pay for a 6-month quarantine. They have to have a 6-month quarantine, and it has to be at an approved facility. And the only way that can happen is if the health director authorizes it. But a lot of people can't afford that.
Yeah.
And so if you have a dog that bites a person, and your dog's not current on its rabies vaccine, technically, if that dog was acting aggressive and they're not current, they may have to be euthanized.
Yeah.
And that's the sad part. And again, where we talked before about how do you prevent it, it's a vaccine. It's a $12 in Cleveland County. It's $12, but I mean, it's an affordable vaccination that can prevent not only a disease, but it can prevent problems if by chance something bad happens and that dog or cat bites somebody. So it's a serious matter. It's nothing to play around with.
Yeah. And that's the video on rabies.